everyone. We're very happy to host all of you for today's event, Plan for Change for Change Edition. So before we continue to the amazing topic that we have, we'd like to first introduce Afflatus Africa. For those of you who do not know, Afflatus Africa has started in 2017. Plan for Change for Change Edition. So before we continue that we have, we'd like to first introduce Afflatus Africa that we have. For those of you who do not know, Afflatus Africa has started in 2017. So we are going to share a video which explains the activities that we've been doing.
Spend their time in events like this. It's very positive. It gives me hope for the future of Rwanda. Reading for Change is an event that enables people to get informed and know more about the world.
Reading the platform. That platform offers to the audience the discovery of the benefits of reading.
This is the opportunity for anyone, regardless of class, to be able to be engaged in a very meaningful way.
But it's really good to be here in an event where people come who read and who talk about what they're reading.
Information is who reads one page travels 1,000 miles.
Without reading, someone remains somewhere in the dark. It is as if you are remaining somewhere in the dark. You are very enclosed. You don't know what is happening on the other side of the Well, one of the things that reading does, it changes you if you want to change.
If you don't read, you are not different from someone who can't read.
Did you know that the number of books you read doesn't really matter?
Reading for Change is inciting into young people. We learn a lot. Every category of people is able to attend. In order for change, we need knowledge. In order for knowledge, we need to read. And I would love to encourage a lot of people at a younger age, even the youth and even older, to bring up that culture of beginning to read.
The work that you're doing is amazing, and I think this organization is really important.
Reading is a fundamental part of life. It helps you to become more brilliant. It helps you to solve your problems, and it can create a curiosity that allows you to move forward in every way of your life.
It's really a good opportunity to share information, experience, improvement in our different professions.
And it's a free event, and I hope we get to see you very soon.
Reading is very important.
And it's wonderful to be here to attend the Reading for Change program today.
I was really excited by the questions that were asked by the students and the energy about youth empowerment and youth engagement in learning.
Reading is very important to develop yourself and to develop knowledge about the world.
Reading for Change, very transformational, very good. These guys are doing very amazing things here in Kigali.
You'll meet lots of people, you'll have really good opportunities to talk about things that are important to you, and you'll learn a lot.
These events are worth listening and learning from. So that's really good.
I lead the change to challenge. I read for change.
So thank you. That was a short video to explain what we have been doing in the past years, especially when we were having our events live physically. So we have a number of programs. The first one is Learn for Change, which is what we're doing here, where we invite different expertise as our guest speakers to talk about different topics that matters. And we also have Reading for Change, the one that was mainly discussed in the video that we just shared. And we also have a mentorship program. So that was a basic introduction about Afflatus Africa. If you would like to know more, you can follow us on social medias and even on our YouTube channel. We have different videos that you can watch and understand deeply what we do. So we're now going to continue with the event of today, and then I'd like to have the host take us through. Over to you, Abawe. Oh, sorry, you're still muted. Can you unmute?
Sorry about that. My name is Abawe Vanessa, and I'm Project Assistant Coordinator in Afflatus Africa, and I'm going to be your host for this event. First, I would like to welcome our guest speaker, Bukuru Germaine. We're very thankful to have you here this evening, and I will also welcome all the audience who are following us on YouTube. Thank you for your attendance. A little more about the audience. The speaker. Germaine is a clinical psychologist by profession, and she has different work background. She related in health institutions. She has different background in health-related institutions, like Rwanda Military Hospital and the Sange Rehabilitation Center. She worked with the United Mission and in Darfur as the liaison officer. She recently was in the national team of trainers on mental health and psychological support during Ebola and COVID-19 outbreak. And prior to that, she had been working in Agaza Shalom as a social officer, and now she's currently working in Kepler as campus officer. In this event, she's going to talk about, she's going to walk us through what is depression, its cause, its symptoms, and the possible treatment that we can have. The floor is yours, Germaine. Thank you.
Thank you very much. As you said, I'm Bukuru Germaine, and I am a counselor in Kepler campus, and I started there in last year in September. So I am happy to be a part of this meeting today. It is my first time. The first time was in December 2019, and I'm very, very happy to be with you today for the second time. So as you asked me to present on depression, the depression is a common mental disorder, and globally, WHO in 2020 said that more than 264 million people of all ages suffer from depression. And maybe among us who are here in this meeting, I know maybe one of us or 10 or how much, I don't know, experienced depression, or we can't say we will not experience it because we have different challenges which can make someone to feel and to have that depression. So the depression, it's a negative affect how people feel, how they think, and how they act. When it is not treated, it can lead to physical problems and can decrease the person's ability to function at work and at home. The relationship at home is not good, and at work also. He may not even leave the job and go at home to isolate himself or herself. So researchers showed that more women are affected by depression than men. Also, depression symptoms can vary from mild to severe depression. So when you have depression, there is some effective management like psychological support or pharmacological treatment. When someone has a moderate and severe depression, it can be treated, and treatment are there, and also the person can have a psychological support. Saying about how people can get depression, we can say people may have the background of mental health, and in genetic, there is some factors that can expose the person to have a depression. Also, we can some personality factors like pessimism, low self-esteem. People may also be depressed because of environmental factors like violence, abuse. All kind of abuse can lead to depression, neglect, poverty, life-changing events like now we are in a period of COVID-19, and many people don't work as they were working. Some lose their jobs. So they can have depression because of life changing. Also, some brain chemistry can change. For example, when people take drugs, and those drugs will go and work in place of some hormones, and the person will remain like that. So the brain change and the brain chemistry change. The person will walk and will behave because of the drugs and whatever, not in the normal life how he was conducting himself or he was behaving. So there he is pushed by other things he is taking, not in a normal way. So we have different types of depression. When we have depression, it can be mild. When the person start feeling bad, feeling that he's depressed, he's stressed, you don't feel good, you don't want to go to talk with others. So there it is, I would say normal, because maybe there is something which is stressing you. Also, when it take long and is delaying more than 2 weeks, it can be moderate. So the moderate depression, there the person, if he has that moderate depression, he start fearing. So there he need support, psychological support or treatment, depending on how the person is affected. Also, when it is delayed more than 2 months, there the person will need treatment, pharmacological treatment, as I said. So there the psychiatrist will treat and also combine with the psychotherapy. So these will work together to decrease symptoms of depression. So we have the recurrent depression disorder and the bipolar affective disorder. So when it is a recurrent depressive disorder, the person feel depressed, as you can see if you saw the depressed person. He isolate himself. He don't want to eat. He's not enjoying his normal life, and there he's thinking that people don't like him. He start fearing that they want to kill him or whatever. So there the person is suffering from recurrent depression disorder. When it is bipolar affective disorder, he has two types of depression. Sometimes he's what we call maniac depressive disorder. So there the person, the excessive irritability. When you talk to him, he has anger. He want to fight. He's overactive. He's overreacting on things, and sometimes he's laughing. He's just showing that he's happy, and between being happy, being excited, being overreacting, there is a period of normal life. And when he's deeply depressed, the second period, there you will see the person in a low mood. There you will see the person, even when you are seeing him, he's not interested in anything. He can't enjoy life. He even want to end his life. Is like those ones who commit suicides. So there the person don't want to talk to somebody. He's there, but can't take food, can't drink, and also he's not interested in anyone. So there you will see the person he has a changing mood. The mood sometimes is happy, sometimes is not happy. So there it is a bipolar affective disorder. So now, when you have depression, there is some feelings or some symptoms you can see to the person, and those are alerting symptoms, and those symptoms can lead you to think on what you can do, on what you can help the person. So the loss of interest or pleasure in activity once enjoyed. When the person have these two symptoms there, you can think on what you can help to that person. Also, there is changes in appetite. The person can gain weight or can lose weight. And that gain or lose of weight is not related to dieting. So there the person can eat a lot or also can don't eat anymore. So there is changes in appetite. Also the person has trouble sleeping or sleep too much, because at night the person just sleep when he's going on bed, and after 1 hour 2 hours the person is awake, he can't sleep again. So there you will see the person want to sleep, he's sleepy during the day, and there he has those trouble in sleeping. Also the person lose energy or fatigue. There you will is because he is not eating, he is not sleeping, everything is not okay. So there maybe started having headache. So there the person doesn't have energy. So when the person continue and lasting in depression, the life is worth and start feeling guilty, saying maybe if I should do this, my father or my mother will not pass away. If I did this, I will not lose my friend. If I should be doing this, I will not lose my fiance, like that. Because there is many things which can cause depression, can cause someone to feel depressed. So depending on what happened, the person feel like he's the cause of what happened. So he has also difficulty in thinking, concentrating. It is not easy to him or her. Also, he can't make a decision. Sometimes he consults different people to see if he did well. Even if he knows that he did well, but he continue asking, is it right what I did? Like that. But other people will not ask, because they will not be interested on what they did, because they don't see why they can do things. They don't interested in staying in life. They don't see why they will go and study, because they don't see the use of their studies, because they say maybe others passed away, me I'm staying here, why am I here, others what do they do to pass away? So he started thinking that to end life, to commit suicide will be it will be a solution of his problems if he has some difficulties in life. So this is symptoms which make people to think that that person is not doing well, maybe has problems which can be controlled and solved in the hospital. So when you see 2 or 3 of these symptoms following the first and the second one, please help the person because he's in need. So how can we help the person to release his depression? So people may do regular exercise. When we tell people to do exercise, is not just to do it, because when you do exercise, you breathe deeply, you enter the oxygen, and that oxygen enter in the brain. So when you have headache, the brain will go. When we say exercise, you build your body, yes, but it will help you to enter that oxygen. So when you feel not good, you feel you start losing hope, just find a friend, find someone to talk to, the one you trust, and tell him or her about your worries. That will help you to feel good because you trust in that person. We also recommend eating the balanced diet because in fruits and in vegetables we find different vitamins and ions. Those we don't tell you because we want to build the body, no, because in fruits and vegetables we find vitamin B12, and that one will act in the brain and release some hormones which contribute in enjoyment. When you are happy, when you feel good, you feel excited, you feel you are happy, there is some hormones which are released in the body. Like when you are not happy, there is a lot of adrenaline in your blood. So there you will feel bad. When it is in high concentration, there the person will feel depressed. But when you eat well, when you exercise with other people, you feel good, you are happy. There is a release of some happy hormones. So also we tell people to drink sensibly because you saw that I said some abuse of alcohol or other drugs will make someone to feel depressed, because when you want to quit to drink alcohol or other drugs, the body was used to use to be pushed by the alcohol or other drugs to act, to react. So now, when you want to stop drinking, there, the body, if I can say some facts or some hormones will not be there to act, because it is like it was sleeping when you were acting because of those alcohol or drugs. So when you want to stop, you will see that people feel bad. People have like sickness. They are every time sick. They are every time don't feel good. They complain every time. So it's because they were used to walk and to act because of drugs. And now when they stop, it is like the body will take time to be familiar of not taking anything. So that will take time and the person will suffer. But in the hospital and the other professionals have how they can help people who want to stop drinking and taking drugs. So also we advise that the person who feels that is depressed or have other symptoms of anxiety or whatever can connect with other people, connect with friends, so that they can exchange their feelings, they exchange their stories, and that will make the person forget about his uh, his uh, his feelings, his bad feelings, and start enjoying life with his friends. We also ask the person to take time and rest, take time and breathe deeply, not as we usually do, like we are learning on something. Just take time and breathe deeply. There you will feel that the pain is released. When you have headache, the pain is released because you are breathing, you are entering the air, and there you feel good. And also the blood will flow slowly in and the body will be okay. So when this is difficult to you, you can't manage all what I said, just look for help, because there you need help. And when it is taking long, it is just a need of help. So please don't keep it on yourself, and don't also last the depression for long, because it leads to the suicide. So, and I can say that people who are depressed, they need family help. They need love. They need someone to ask them what is happening. And when he feels that persecuted by someone who want to kill, they need someone to be there for them and comfort them. So please, when it is like this, take the person to the hospital. And when it is difficult to find how you can help him, you can just advise his parents, his colleague, and the person he's in a trust, and that person can help. So that was my presentation, and if you have questions, the floor is yours. Thank you.
Thank you very much, Germaine. I do have a few questions I would like to ask you. The first is, what do you say to this sentence that says, depression is just the result of having a tough time? What are your thoughts about that?
Okay. It is not every time when you have a hard time, because not everyone who has a tough time, a tough life, who has depression. It is a kind of the person, the how the person is, and the background of the person. So other contributing factors will be should be there to let that tough life or tough relationship can lead you to the depression. Not every time.
So a person can be depressed without having any failure in their life or any troublesome background.
Okay. When you are a human being, normally we can't say we don't have problems. We can't say everything is smooth to us. So it depends on how you take things, because you may, for example, you are a student, and you may have, for example, you have assignments. They may be 5 or 6, and there you say, they are wrote. I can't do this. How will I do this? So why do I have to do? Even I know I will not finish. So when you have negative thoughts, you think you will not succeed. You feel you will not end your journey. So there, the way you take things, the more you can have difficult, you can have stress, and that stress, when it lasts long, it conduct you to the depression. You can't just have a problem and you say you have a severe depression. You first have problems, you have bad feelings, you have negative thoughts, you change in behavior, then you start feeling depressed. There it is progressing slowly, then you go in deeply in depression. So it depends on how you take things. Yes.
Thank you. My other question is, what is the difference between how people view physical and mental health problems?
Okay. Here, I don't know if you understand about stigma. About stigma is when people can uh, can can prevent you on on right of getting treatment, if I can say. People don't appreciate to know that they have their own who are suffering from mental problems. And also the person in himself or herself can stigmatize himself or herself because he will not go to look for treatment because he think other people will say that he's okay, he's sick. He has what we call in Kinyarwanda umusazi. He's thinking that he's mentally ill. So other people will say that I'm sick. So he will stop going to look for treatment to the mental health hospital to look for help because he think people will stigmatize her or him, or at that time the person is stigmatized himself. So the way people understand about mental health is different, and also it is still low because you know we see people who are running in roads in ways and we see that they are not feeling good. They are maybe their own don't know where they are. If it was malaria, diarrhea, or other physical disease, they will take the person to the hospital. They will ask someone to help them. But when it is a mental disorder, people don't like to show that they have their own who is sick, and to look for treatment is difficult to them. Sometimes you will see people who taking their own to the traditional treatment for to look for traditional treatment, and also what we call abapfumu. So there they think the person is he has like diamonds. He's attacked by diamonds. Also, there they will not go to the hospital to look for treatment. They will go for to those abapfumu for to see what they can do so that their beloved ones can be cured. Also, the other people, be depending on their belief, they will think that uh, people has a kind of spirits who attacked them. So there they will take the person in the church, and when it take worse, when it is difficult, when it is chronic, they bring the person to the hospital, and there it is ready to treat the person, and it will be difficult for him to get better soon. So people who believe in spirits, in bad spirits, and about diamonds, they will go in the church. And others who are saying that their own are poisoned, they will go to look for abapfumu. So this is how people look or understand about mental health. But we still have a low number of people who take their beloved in the hospital. It's not all of them who think they will look for traditionals, but there is other few people who look for help in the hospital. But it is still not as how they take about physical diseases. Here it still have a stigma in mental health disorders. Thank you.
Thank you again. One more question is, can a person be depressed but not suicidal?
Come again?
Can a person be depressed but not suicidal?
Okay. When the person is depressed and get treatment, he will be cured very, very quickly. But when it take long, it is like the person, when it is treated, it is disconnected to the reality. that person think that everything is difficult to him. He can't see how he can resolve those problems because he's not on his own. So the person think has I told you about negative thoughts. About those negative thoughts is about whatever I can do, I will not succeed. I can't do anything because I don't have anything to feed, like those aged people. You see about those ones from who are victims of genocide, 1994 genocide. You see, they lost their own, and many people they don't have any family member. There, they can be depressed because they don't have anyone there, because they feel they are feeling alone. So they may be depressed, and that depression can lead to those negative thoughts, and also think that if they do things they will leave those things because they don't have their own. If I do this, it is just to feed other people. If I do this, why? Because my kids are not there to eat this. My kids are not there to have my property. So I don't have to do this. So when the person have that negative thoughts, it is a sign which shows that the person want to end life. Not every time when he's thinking like that, it is leading to the real suicide. But those suicidal thoughts, they are like that. You feed him or her and say, "Why are you giving me this?" Do you think the person will survive because of food? You lose your time to do this. So there, understand that on addition on those symptoms you saw, when he has those kind of words, start thinking on how you can be there every time, on how you can help your friend because he has those suicidal thoughts, and those suicidal thoughts will end on the action of suicide. Yeah, thank you.
Uh, Thank you. I would like to ask one more question. You keep saying that depressed people have negative feelings or negative thoughts about what they are doing, maybe about their everyday activities. But how about the person who has existential crisis? That person is not having negative thoughts, rather, he's questioning everything around him. And if that person doesn't see the point in anything, and that person will start to feel depressed about everything because they wouldn't be seeing the points of about anything, then how will that person also be depressed even though they don't have negative thoughts?
Okay. Normally, the depression, not everyone can have that negative thoughts which indicating that the person want to end life. It depends on the person, because you see, people may be depressed but believe in God, and also they may not showing that they are believing in God, but they believe that if they do and have help, they can solve the problem. So there, it is different. Not everyone have negative thoughts, but he's depressed, but has symptoms. Those symptoms I said, of losing interest, of doing things he were enjoying, of also lose weight, don't eat properly, or also have difficulty in relationship. It doesn't mean that the person, every person who has depression will have a negative thought, but also we think about personalities. I said some contributing factors of personality, like someone who is always negative. What I said, pessimism. That person is that one who should have the negative thoughts. But also, there is people who are introvert. Those people who are introvert, they will not say anything. They may have negative thoughts, but you don't know because they don't talk to you. They can't share those negative thoughts. Is those people who you will find that they are inside the room, they don't go out. Anyone knows that they are inside, and you will find a dead body inside the room. It depends on the personality of the person. But also you will see those people, even if they has depression, but they want someone to every time understand their points. They want someone to appreciate what they are saying. If you don't appreciate, it is a problem. So people are different. Those who are the extrovert, they will share their feelings, but others, they will not. Those ones who share, I will say they are good people. It will help others to help them. But those ones introvert, it is not easy to find out what they are thinking. You will just see the action. So you will see they are like they are happy. They show you that it is good. When you talk to them, they are just showing by head, accepting what you are saying. It is true, but inside of them, they are saying you just leave the area. Then I end my life. So it depends on the person and his personality to know that this one has or not have those negative thoughts. But not necessarily everyone can have negative thoughts depending on belief, because belief also can change the person on how he's behaving, he's acting. Because you see, there is some people who feel bad, who are sick, even in malaria, and you go in the church saying they are going to pray and God will cure them, and they know it is malaria. When they are pregnant, they are going there. So yes, to pray is good, but also doctors and nurses and those professionals, it is God who made that knowledge so that they can help people. But depending on the belief, the person will have how to think. So it is like that.
Thank you. Now I'm going to read some questions in the comments. Miana Jessica asked the questions that goes like this. When you're depressed, it is hard to trust anyone. So how can that person be helped without making that first step of trusting someone?
Okay. As we said, to help the person, it is what we recommend people. Where I told you that you look to someone you trust to talk to him, to share your feelings. But there is the extent from where the person don't trust anyone, even her parents or his parents. He will not trust them because he knows that everyone don't like him. He think everyone can even poison him. So why he refuse food? They refuse food because they think people don't love them. So if they don't love, they don't like, they will kill them. How? By giving poisons, by killing, by other materials. So why they can't trust anyone? So when it is at this extent, it is what I said, severe depression. When there is negative thoughts, when there is no trust, when there is a change in behavior, when the person is isolated to other people, there is no good relationship there, the person need help. So you can, when you have that problem, you will not trust in anyone. But people are there, friends, family members, if he has family members, there is some signs showed that the person is going deeply in depression. Maybe they may not know about mental health, but they will say, that person changed. That person, maybe he's attacked by diamonds. That person, he even can't eat. Maybe he's not good. So people start guessing that the person is not good. So when he refused to eat, you will find even in his room, he has a weapon, something he will use to fight, because he's ready that the person is coming to kill him. So you will find under the bed there is stones. You will find he packed everything because he's ready to go. He's ready to leave the room. He's ready to commit suicide. So he put everything in order so that they will not find any some the room. Okay, to let people find the room organized. So there you will find the person maybe want to go or want to finish his life, depending on what you find in the room. There is other people who will use poisons. They will go and buy and hide somewhere. Just they are waiting of something, some provocating reactions to commit that suicide. So they may not trust in you. They may not trust in anyone, but you are there as a friend, even if he is not trusting in you, but you know that your friend changed anyhow. So your friend need help. There, when it is difficult, you even saw people will look for others, third party, to come and help the person who is suffering. Other people, they may call police. When the person attempted to commit suicide, even police is intervening to take the person to the hospital. So depending on how you see that person, he's not trusting you, but you can do something to them. Also, other thing, when he's not trusting in you, you just advise. When you see they start changing in behaving, changing in how they think, you can advise them. You say, maybe you have this, but I understood, I heard that there is some people who can help you coping with this life, with this difficult moment. Maybe if you call him or her, he may help. So the person may understand you, may think you are right, then he can ask you to guide and take him to that a person you are telling him. But others may refuse, and when they refuse, you can't let him commit a suicide. So you can look a way of helping the person. Thank you.
Thank you. Let me check for the next questions. Then the next question is from Keza Brender, and it says that how to explain to people around you that you feel depressed or more than normal sadness without having them thinking like you are weak or you are joking.
Okay. So as you are asking this, it made me thinking about stereotypes, how people think about mental health, and how people think about people who have those problems. They may think that they are weak. They may think that those people they committed a sin. So People may be depressed, but don't mean that they are they don't it is not me it doesn't mean that they are not strong. No, the body react differently. You may take news, for example, God forbid, I don't wish anything to happen to you, but someone can lose the person, the loved one. But when you lose that person, you are two in family. The one think that this is the end of life. If this person is going, how will we survive? How will we pay our school fees? How will we feed ourselves? No one is working among us. So this person may be depressed more than the second person who will say, even if he's going, there is other people who stayed alone but survived in this country. There is other people in low age but managed to survive and reached their goals. So these people, they have the same problems, they have the same issue. They lost their beloved ones, but here they react differently. So the one who reacted in that way with bad thinking, don't mean that he's not strong, he's weak. No, that person, he's concerned, he's thinking on how he can help, because after that thinking, he can find a strong behavior, a strong idea on how he can help his young brother or her young sister. So to feel bad, to have a problem, is not because you are not okay, you are not strong. It will depend on your genes. How many of family members who had mental disorders? So there, if you have genes of mental disorders, there it is not because you are weak, it's because you have some contributing factors, those genes. So when you have a hard time, like those uh, what you like genocide, like accident, like, so you react differently. So it is a difficult time, it is a shocking event which is coming to the person who has already he is vulnerable because he has that genes, but not because he's not strong in what we call strength or weakness. She's not weak, but he has those genes which expose him or her to have those problems, or to feel bad, to react differently on the same issue which happened to different people. So it is like that. It's because of the body, the genes, the background, the environment. Those things, they may be a lot of things, or a lot of different events, difficult events on you, and you are a human being, and you can't manage them at the same time. So there you will maybe feel anxious, or you may feel depressed. And if there is nothing to help you coping with that life, you will lead to depression or anxiety or other mental disorders. But when you get help, when you have social support, when you have friends who are there for you, when you have others who are telling you how they manage their life in those difficult problems, there you will feel good and you will know how to handle your situation. Thank you.
Thank you very much. The next question is from Sir Capita. He's asking that why do we find depression among those who are rich? Because is it because they have what they want, and but he's like they do have what they want, but they end up getting depressed. So why do we find it in most of rich people?
Okay, thank you. Depression is not a disease of poor people. When you are rich, those rich people, let's take an example of those ones who sell things. You see, they every time count money. They count money. Even when they are sleeping, they are counting. So they can't sleep well. Their sleeping is disturbed because they sometimes getting awake because they are remembering someone who they give something without paying. So those rich people, they have many things to do. They have many things to think about. They are building, and they are looking in different areas so that what they are doing they can perform well on what they are doing. So those people, they don't sleep. They can't sleep. So when you have many things you are doing at the same time, you see, when we are saying stress management, it is one topic I discussed about you on in 2019, in December 2019, about stress management. So when you have many things to do, you are stressed because you want to perform. You want your leaders to know that you are a good person. You work hard, so you want to perform in everything, and you can't say no. You can't say these things I can't do them because I have many things. So you always accept what they are telling you, so there, it is a lot of things that you can't manage. So when you don't manage things, as those rich people, they have many things. They have different what agencies they are reading. They have different people they are managing. So they 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 don't have that time to sleep. When you don't sleep, you get stressed. When you get stressed, and it lasts for long, without sleep, without eating, without having other people to share your feelings, without having fun with your friends. So there, the stress will lead to depression. You have many things to do. You are rich or you are poor, you will have depression. When you don't manage your things, you will have depression. Yes, people who are poor may be depressed because they don't have something to feed their kids, and the kids can't stop asking for food. They can't stop asking for school fees. They can't stop asking to buy for them a car. Those to buy for them something in the supermarket. So they don't know that you don't have money. Their parents are rich. All of us have been a child. So we know what we asked our parents, and we even don't know that they don't have money. We don't know. We are there, and we are looking for at them to give us what we need. So parents who are not sharing with their kids, I'm saying those who are getting, who are old, they can share with them. So, but when you don't share with them, and they always ask you many things, you too, even if you are rich or poor, you will be depressed. So, to be depressed, will not ask someone to be poor or to be rich. Everyone, every color, every sex may be depressed. Thank you.
Thank you. There's another question from Peter too, I think. Let me check again. It says, wait a second. It says, is shyness or difficulty in giving your opinion a sign of depression or just lack of confidence? And how can that be solved?
Okay, so when you are depressed, you may lose the self-esteem, because when you feel guilty, when you are guilty, saying that if you were there, the person will not suffer from the situation in cause, depending on how the person suffered from. So when you think your friend shouldn't have those problems because you were not there, so when you feel guilty and when you feel you have no hope, there is no self-esteem, you feel whatever you can do, you can't succeed. So you have no hope, no esteem, and you go deeply in depression. So to when you know that the person don't have a self-esteem, you have to know in treatment we have a different kind of treatment. As I told you, we have pharmacology and we have psychological help. So in psychological help, we have what we call an approach which is cognitive behavioral therapy. So the cognitive therapy, we work on how the person think. So those negative thinking, when you make the person to access the reality, to feel that he's loved, there is someone who is loving him or her, to show that person he still have, to let the person find in him the source of strength he remain with, because he may feel he hasn't anything, but you help him to find like something which will help him to survive. Maybe he may lose his loved one, but still have his young brother. He still have his friends. He still have his studies. When he finishes studies, he will have a job. After job, he can provide anything he wants. So if he loses that hope of surviving because the parents passed away, there he will maybe think, it is true that when I will finish studying, I will have a job, then I can feed myself. I can buy something for my young brothers. So there, starting thinking in a positive way is how we help the person with low self-esteem. So we work on that cognitive area to end those negative thoughts. So when he's thinking positively, the self-esteem will come on his own. So always thinking in a positive way, thinking that if I do this, I will succeed. Thinking that if I don't know this, I have to look for help, because no one is sufficient to him. No one can can think that he's enough. everything he's doing will be on his own. No, you have to look for help when you think you can't manage. Also, you can provide something to others. When you help others, you help him, he feel better, then you too, on your turn, you feel better. So the self-esteem will come on how you will see how people are happy because of you. You will see how other people are surviving because you helped in a small way. So there, that small things you did will make you to think, hey, maybe I can be appreciated. When you say you tell to someone, you dress well, and the person say, thank you very much, you are the one who told me that I'm wearing well, I'm beautiful, I'm handsome. So there you will think, I'm appreciated. So you continue to do the same things, to do good things to others, to your own. Be positive to you, do good things to you, then you do to others. First you, then others. And when we are saying about self-care, for the self-esteem, as that person said, when you exercise, you go in gym, you go in learning, you go in some kind of exercise, you are with other people, you make friends, you connect with others, you gain from them, you feel better because, yes, you gain from that air you are breathing, but also seeing other people happy will make you feeling happy too. So the self-care will help you to feel good and to to motivate you for your self-esteem, to eat well, to sleep well, when you are released, when you don't feel pain, when you feel good in your body. So there you will, the self-esteem will come because you don't have any problem, you don't feel bad, you don't have any pain. So you do good things, you do your work, you finish, you have what you have to do, and you prioritize your actions or your tasks, then you end up by managing your situation. So that is what will help you to motivate you for your self-esteem.
Thank you. The next question is from Keza, and she's asking, how can a person overcome depression or suicidal thoughts and such without having to talk to anyone or to get help from anyone else?
My friends, when it comes to negative thoughts, when you are stressed, okay, there is a difficult moment, there is a contributing factors, there is a challenging situation. So there, when there is a challenging situation, you start by being stressed. So when you are stressed, it leads you to the depression. You feel sad, you feel unhappy, you have hunger. Mm. You don't want other people to enter in your life. You don't want to share with them. So there you start by those signs. Then when it come it read when it lasts long, more than 2 weeks, it's where uh, you start thinking in a bad way. You have those negative thoughts. So when you start, you are to that moment, as I told you that there is a mild depression. When it is mild depression, there is no negative thoughts. You just you just lose weight, maybe. No, you lose your interest in something. You just don't want to talk to someone. You just feel headache. But there, it is not handicapping your normal life. You can go and work. You can cook when you are coming at home. You can whip. You can don't every time you usually what you usually do, you continue doing. But when it comes on when what you were thinking cause you to don't go to work, you say you still have those rules of hope, that rules of interest and rules of appetite, and you start having problems with work. You don't go for work. You don't work to study. No, you don't go to study. You don't go to the market if you want to buy something. So if you start thinking in that way, you don't want to go somewhere, you don't want to face people, there it no longer mild depression. It is a moderate depression. So when it is a moderate depression, there you need psychotherapy. You need someone to talk to, a professional. But the mild one, it can end on itself. When the challenging situation is going, just you are coming better to your normal life. But when it doesn't and it lasts for 2 weeks, it is moderate depression. So that moderate, on those signs I said on the previous ones, there is addition of isolation. You don't go out of your bedroom. When someone knock on your door, you don't open, you don't eat, you don't take shower, you don't even brush your teeth. So there, it is severe. So from moderate, you need help. You need to talk to the professionals. And when you don't go to look for those professionals, it will ask, when it lead for 2 months, it will lead to the severe depression, and there you will need to have those medical treatment. What I can say, you can have the antidepressant because it take long, and you are to the extent of negative thoughts, bad behavior, bad reactions. You have some you preventive measures because you think other people will come to kill you, and you have some knives in your room, you have stones, you have what, anything which will help to fight with the other people who will come to you to fight with you. So there you need treatment. They will give you medicines, and those medicines will be mixed to the psychotherapy, what I said, cognitive behavior therapy. So they will work on releasing symptoms, physical symptoms, to let you sleep, to let you don't have headache. So when those symptoms, alerting symptoms disappear, you will continue receiving psychotherapy, which will work on behavior. So they will work on your negative thoughts to let you thinking in a positive way, and also to help you engage in some activities. If you stopped working, they will help you so that you can engage in continuing doing what you were doing before, going to school, going to the market, going to the church, doing something to help you surviving. So they will mix those therapies because uh, it engage different area of the body, the biological, the social, and the which in entire will affect the body. So they will help you in those different ways. Socially, they will help you to communicate with other people, to connect with them, to have good relationship with them, because they will even engage your family members in treatment so that they can help you depending on how you are, because your relationship was not good, and they may think that that person, he's not sick, it is just because he doesn't like to be with us. So there they will explain how the sickness is, then to help them on how they can handle your situation. So there it is socially. Also, if you have some difficulties, you have financial issues, so it is about social, so that they will know everything, so that they can see how they can help. If they don't know how they can help, they will connect you on where from where you can find those help, financial help or social help, so that you can feel good. After that, they will just, you will feel good because the cognitive is okay, behavior, actions, you are engaging in the actions, then socially you are good, you are relating in a good relation, you are in a good relationship with your friends and family members. So there the person will behave normally, and it will not take long to treat that person if he has a family help or friends help. There the person will be treated and getting better as he's helped in different ways.
All right. Thank you very much, Germaine. We have no more questions. So would like to thank you for your time. We've learned so much from you, not only what depression is, but how we can prevent it from ourselves by having friends or joining different activities, and also what we can do once we feel depressed or we have a friend who is depressed. So I hope our audience will incorporate that in their own daily lives. They, like all things we've learned, we must put them in actions. It's not just about learning; it's also about actions and implementations. So we thank you all who have been with us, and we're also looking forward to being with you in our next events. As you know, we have events every Saturday, so please be there too. And yeah, all of you have a lovely evening. Thank you so much.